phlegm, mucus. And we find that's practically all the same, but it's an elimination, and it is something that you must get rid of. Now, the bowel is only one channel of elimination, and when we have an excess amount there, we find out it's backed up into the body. This is called auto-intoxication. We've had that same condition happening in the skin. Most people don't have a normal skin, a dry skin, underactive skin from probably using salves and using a lot of the cosmetics that we use on the skin. Many people using the powders and the oils on the skin. You can clog up these pores so that we don't eliminate properly. We can do the same thing with the kidneys. We can overtax these kidneys. It's possible to have an inherent weakness in the kidneys. We find out we cannot expect them to overwork and to carry off a lot of this toxic material that we build up in the body that has to be taken out by the kidney structure. There's some 30 different acids in the body, and these acids, most of them have to be taken care of by the kidneys. If you don't get rid of these things under normal activity, you find out that any one of these elimination channels can give you symptoms and problems. When a person has an excess amount of hawking and spitting and getting rid of this catarrh that we have in the mornings, it's a sign that you really should get rid of it. You shouldn't be stopping it. But there is one thing that most people are doing today. If they have a catarrhal condition in the body, they stop it. Now, what are we going to do? We're going to stop it. But we're going to stop it with a remedy that has a recovery. If you stop that catarrhal discharge in your body, you're on your way to more auto-intoxication. You're on your way to more toxic materials that'll work out through the skin. Boils, pimples, psoriasis, and all our different skin disturbances. You're on your way to having more kidney troubles that can end up in nephritis, end up with all kinds of kidney disturbances. And I will say that when you do not take care of this catarrhal elimination properly and let it flow, you find out eventually you're going to be in trouble. It is when you stop that catarrhal discharge in your body that you're on your way to a growth, to a settlement of that toxic material that settles in the sinuses, finally in the ears, as a mastoid. We find out it can pass off through the vaginal tract, in through the female organs. It can cause cysts on the ovaries, on the fallopian tubes. We find out it can cause congestion in the prostate gland. You can have it in the form of a cold. I'm always having the flu come up every year. One lady was telling me how she's had pneumonia 4 times in the last 5 years. This is not something to brag about. I think we should get back to the place now when we stop making this catarrh. By the way, when this catarrh eliminates all this toxic material in the body, don't stop it. Keep it running. Do you know what catarrh means? It comes from the Greek word meaning I flow. It means to run. It comes from the Latin word meaning cathartic, to get rid of. Well, get rid of it. But if you keep making it day in and day out at the dinner table, or the lifestyle that you have, working all night, on the croup shift, or the graveyard shift as they call it, if you don't treat your body right and keeping it well with the energies that it needs, you're not going to get rid of the toxic materials. And where's it going to settle? Did you ever hear of a toxic thyroid? Yes. That toxic material can go to thyroid. It can cause an underactive thyroid gland, which will come about and affect the metabolism of every other organ in the body. When that thyroid is underactive, every other organ can be underactive as well. It's hard to believe that an underactive thyroid can even cause constipation. So constipation, adding to the troubles in your body, to the toxic materials, and as it goes to the different organs, finally comes back to the bowel again. There's a vicious circle that happens when we don't get rid of this toxic material on time and with all that we should when we do have it passing off of our body on time. So this toxic material here is something that the average person doesn't take care of. In fact, the average doctor doesn't take care of. And we're going to go into this from a food standpoint now and a nourishment standpoint.